It's a new year with the same problems made even worse. Tonight, in case you needed it, more proof that COVID does not care what the calendar says. Now, while there is reason to hope 2021 will eventually mean the end of the pandemic, getting there will be a dangerous journey.
On this first day of the new year, the United States officially has reached 20 million cases of COVID-19. To put the level of that failure into perspective, we have the most cases in the world. The second worst in the world is India, and even though they have 4 times as many people as we do, we have almost twice as many cases as they do. California is the worst of the 50 states. Today, it reported 585 COVID-19 deaths in a single day. And their hospitals are, according to one health official there, on the brink of catastrophe.
Here in South Florida, cases are surging and the positivity rate remains above 9%. And all this is without knowing the effects yet of holiday gatherings. For more, let's go live to CBS 4's Jessica Vallejo. Jessica?
That's right, Elliot, Lauren. Well, last night on New Year's Eve, we saw many people out, and many of them were not following those CDC guidelines. But what's really concerning now, health officials, is that new strain that is now in Florida that came from the UK, and they say it's 50% more contagious. Take a listen.
Things are really bad. We're overwhelmed.
It's the new year, and exhausted healthcare workers are starting 2021 much like they ended 2020, trying to save lives in hospitals overflowing with coronavirus patients. Southern California hospitals are so overcrowded, some are beginning to ration treatments.
This battle, we are so outnumbered.
And the new year also brought in a new strain of COVID to Florida that was first identified in the UK. Daniela Levine Cava, mayor of Miami-Dade County, says
this new variant, more contagious, just tells us once again that this is not child's play.
Finding variants is key to stopping new clusters, but the U.S. is doing only a fraction of the genetic sequencing needed, says James Liu, president of Helix, a company helping to track the presence of this new strain.
We're probably undersampling. We're likely to be having some circulation of that within the community itself.
Dr. Eileen Marty, an infectious disease specialist who has been on the front line since the very beginning of the pandemic, says the new variant is believed to be 50% more contagious, and there is a growing concern because it spreads faster.
And if you think about the reality about this variant, it has 14 mutations, and of those 14 mutations, 3 are particularly bad because they're altering how the spike protein works and how it's shaped. But first, it latches on better, then it gets into our cells easier. And another change that's part of these 14 mutations is allowing the virus to replicate faster inside our cells, which means that each person that gets infected with this has a lot more virus to share with others, and the virus they share is more likely to get inside your cells and cause damage.
Health experts are predicting an explosion in COVID cases, partly due to New Year's gatherings and people traveling over the holidays. This was the scene New Year's Eve on South Beach. In Las Olas, it was packed.
When we let a wild virus spread, not only are we increasing the risk to individuals, especially high-risk individuals, we're also facilitating the creation of more variants. We may get to one where the vaccine doesn't work, where the monoclonals don't work, where we have to start all over again. So really, it's super important that we all do everything we can.
And earlier I did ask Dr. Marty, will the vaccine protect you from this new strain? Well, she says that's the million-dollar question. Although she believes it will protect you, they are still testing this new strain. We're live in Miami. Jessica Vallejo, CBS 4 News Tonight.